Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by Sue from South Africa, who takes LDN for Ehlers-Danlos syndrome and other conditions. Thank you for joining us today, Sue.
It's a pleasure. Thank you for hosting me.
So you were saying that this only started to happen 6 years ago.
No, the diagnosis was only 6 years ago, but Ehlers-Danlos is something you're born with.
Okay. Would you like to give us your story? You can tell us everything. We'd love
All
to.
right. Should I just speak about the condition before speaking about LDN? We can speak about that.
Yes.
All right.
Mm-hmm.
So I was always quite a fragile child, and I had been born with a couple of small, I don't know, I want to call them deformities, but they were perhaps more minor than that. I think in this day and age, it would have alerted the doctors to the possibility of Ehlers-Danlos. So they were what they call midline defects, like, excuse me, an indented sternum, breastbone, a little dimple at the base of my spine where the skin didn't heal, where I actually needed surgery as an adult. So the doctors had said to my mom when I was a baby, nothing to worry about, absolutely nothing. Which was not the case. It was quite a severe problem. So those little defects weren't seen as the red flags that they should have been and maybe could have been today. Other little things like a very high, narrow palate. I was a bit of a frail and sickly child. I have memories of just never keeping up with people. We used to go walking as a family, and I just always struggled to keep up. I couldn't play sports. I was hopeless. I was always the last to be picked on a team, which was actually very traumatic. And I think if people had known that they were dealing with a disabled child, I wouldn't have been subjected to that sort of thing. My mom was quite understanding when I was young. As I got older, I think sympathy just faded. The people expected me to grow out of it. And Ehlers-Danlos is a genetic connective tissue disorder. It's not something you can grow out of. So in my teenage years, I just struggled more and more. And I also developed post-traumatic stress disorder because I'd been bitten in this eye very badly by a dog, right into the eye, just before my 10th birthday. So, and that was in 1975. Post-traumatic stress disorder was only included in the DSM in about 1980. So I wasn't diagnosed as having PTSD, but I had very severe PTSD. And having Ehlers-Danlos syndrome also predisposes people to developing post-traumatic stress disorder because our autonomic nervous systems don't function brilliantly. We're a bit vulnerable in that way. So things like insomnia, anxiety, depression. Those were my diagnoses when I was a teenager. I then got tick bite fever. I was hiking with some friends in the mountains for 5 days, which I could do at that age with difficulty, but we went slowly. None of us were particularly fit. And I was the only one who got tick bite fever. I was treated for tick bite fever, but I was treated once off. So they treated me for 5 days, and I developed Lyme disease, unknown. Lyme disease, which in this country is also called rickettsia. And that stayed in my system for a very long time until I had antibiotic treatment as an adult. So that resulted in my adulthood as a diagnosis of ME/CFS because it was just a general fatigue and pain. I had migraines, I had undiagnosed endometriosis, I had this Lyme disease or rickettsia. All of these things are actually linked to Ehlers-Danlos, as well as the psychiatric side. So as a teenager, all they saw was the psychiatric symptoms. What they didn't know, because nobody asked me, is, are you actually coping with carrying? We used to carry our school bags with heavy books over one shoulder. I have a bit of scoliosis. Nobody ever considered that maybe there was a physical problem, even though I'd always been terrible at sports. I started swimming. I had a bit of a nervous breakdown in my final year of high school. I had to drop out of school after being a straight A student. Um, and I just started swimming. My parents had a big swimming pool. So here in Johannesburg, we have rather lovely weather. And I swam up and down and up and down and up and down while other people were finishing their school, their matriculation. I later tried to go to university. I was hospitalized. I had treatment, purely psychiatric. I went to university. I lasted about 2 years with great difficulty and ended up dropping out of university, did a bit of part-time work, stayed at home, I was kind of the homekeeper, homebody, whatever, and finished my degree by correspondence many years later. That was my BA with psychology and English. Then I did a BA with majoring in BA honors, sorry, in psychology, and I went on to do a master's in research psychology. So by then, I was far more aware of the fact that I had post-traumatic stress disorder, and it's been a pattern in my life that I've been the one to go. As a young adult, I looked at all these things that were happening and the things that I was doing, and I thought I've got a dissociative disorder. I went to a psychologist who I had seen before, and she confirmed it and referred me to somebody else because it wasn't her specialty. The other person confirmed it as well. I also had the same approach to post-traumatic stress disorder. This is what I've got after studying psychology. Yeah, they confirmed it. It was actually the same with Ehlers-Danlos syndrome. So I've had a lot of jaw problems. I had orthodontics as a child. I had 7 years of orthodontics because it wasn't very successful, because there were all sorts of issues happening that people didn't detect medically. My siblings had a year or two, just the normal treatment. I was stuck with this thing for 7 years. I had a very bad crossbite. I still have some facial asymmetry, and an underbite. And I was told I needed jaw surgery. So I was about 17, and I just said no, because I hadn't had any therapy for this facial injury. And I was still really struggling with the trauma of that. And I was too young. I was not able to take that decision correctly at the age of 16, when the orthodontist said to me, right, I've done what I can with braces. I need to do surgery. We need to do surgery. I just said no. I came to regret that. I had the surgery when I was 50. I am now back for the third time. I'm having further treatment for TMJ disorder. So I've had a lot of chronic pain in my life and a lot of fatigue, which, now that I've had the correct diagnosis, so ME/CFS was not very helpful. It was accurate in its own right. All of those diagnoses have been accurate in their own right, but they didn't get at the underlying problem. So knowing that I had Ehlers-Danlos, which came about because of the jaw treatment, I got referred to a physio. She took one look at my jaw movements and she said, you're hypermobile. And the only reason she knew, because I'd seen many physios, physiotherapists, many GPs, the only reason she identified it was her child had it. So this has also been a pattern where the practitioners who've been most able to help me have had family members with the same condition. I then, because by now I had my research master's in psychology, I researched hypermobility syndrome. I came to Ehlers-Danlos syndrome. And for about a year, I did go back to my GP and I said, I've had this diagnosis of hypermobility syndrome, but I think it runs deeper because I've had all the digestive issues and the insomnia and so on. And eventually I went back to her and I said, I think I've actually got Ehlers-Danlos syndrome. And she had obviously done her own research. She confirmed it. And it's not a nice diagnosis, but it's very good to know what you're dealing with. And that, I don't want to carry on about the diagnosis because I think we're here to talk about LDN particularly. That was what led me eventually to LDN. And again, I had to ask for it, but asking for it, I immediately got it. She gave me a script and it has been a life changer for me.
So when you first started, how low a dose did you start on?
Very low. So after being diagnosed with hypermobility syndrome and realizing it was probably Ehlers-Danlos, I joined, I mean, it sounds terrible. You know, I've had medical treatment all my life, but I joined a Facebook support group for people with hypermobility syndrome and Ehlers-Danlos syndrome. And I had been on groups for ME/CFS, which didn't help me in terms of the pain management. The group for Ehlers-Danlos syndrome was the one to look at for the pain management. So what happened was, pain is something you just live with this condition. I've lived with it all my life, and obviously, as you get older, it gets worse, but your management ability becomes better. So it's kind of this constant balance. After COVID, so the injections, the jabs arrived in South Africa, they became kind of mainstream only in 2021. And I had this big debate going on in my mind about whether to even get a jab or not, because I'd only ever had one flu shot and it made me desperately ill. And I'd ended up with an Epstein-Barr diagnosis and everything. But in the end, so again, I was looking at all this and I consulted my one specialist, the one who treated me for tick bite fever. I said, is this worth getting? I'm a risk in terms of my reaction to the jab. And he said, we don't know. We don't have enough. He's an epidemiologist. We don't have enough, a doctor of infectious diseases. We don't have enough information yet. You're going to have to make your own choice. So I decided to go ahead and get the jab. The first one made me pretty sick. I was sick for about 2 weeks, but very sick, like couldn't work. And then I started feeling a bit better. And then the second one, and I had a lot of trepidation, but I went ahead and got it. I got so sick after that second jab that my pain level was through the roof. My immunity was not coming right. And so this was now towards the end of 21. That was when I went back to the Ehlers-Danlos groups. I'd already read about LDN there, and I'd kind of filed the information for future reference. And I went back there, I checked on everything. I saw what people were taking. I saw what they were saying about the jabs and the effects. And that was when I went to my doctor. I said, could you give me a script for LDN? I'd like to try it. And she said, oh, certainly. We usually use it for people with thyroid problems, but yes, we can try it for you. So I'd also known from my reading that I could have very severe side effects. And knowing me, I was going to have the worst side effects for the longest time, which is exactly what happened. So it's not a decision I took lightly, but because I had been braced for the worst, I was able to manage it. So I knew if I went on to the LD, and I think it was probably early November, maybe late October, I gave myself 3 months to fully adjust, because that is what the people on the support group were saying. Some of them were saying we had no side effects, virtually none. We adjusted within a week or two, and I thought that won't be me. I know what I'm like with medication. I know what my system's like. And I think probably by then my system was just also very, very run down. So my doctor started me on 0.5. What was difficult about that? May I just speak here, or do you want to ask questions?
Yeah, no, you're fine. Carry on.
What was difficult was my doctor then went on leave. So she'd given me the script and she hadn't briefed her receptionist about the fact that this should go up incrementally. So she said to me, we'll go up a little bit every week or every 2 weeks, no more than that. Take it very slowly and keep the dose as low as you can. I can't remember how long she was on leave for, but I remember struggling quite a lot with this. There was a lot of backward and forwarding between me and her receptionist. And I'm saying to these ladies, you can't keep giving me the same script. I'm now ready to go up to the 1 milligram. And then they had to get their locum doctor, and it was just a bit chaotic. And that made me realize this is not something they were used to doing. I think now they are. So the same doctor, she is the most amazing doctor. She actually eventually, I think 2 or 3 years down the line, she said, as I walked in there, I had a bit of an ear infection or something. She said, I must thank you. I said, why? It's not what you expect when you go to see a doctor. She says, because you've raised my awareness of Ehlers-Danlos syndrome, and I've just diagnosed, in the last few weeks, I've diagnosed 2 young women, 2 teenagers, with the same symptoms, whom I would have missed before completely, which is what happened with me. So that was quite gratifying. And I think a similar thing has probably happened with LD, and I know that they are treating more people with it now than they were. But that was difficult. It was a difficult beginning. I went from 0.5 to 1. I can't actually remember the time frames. I know it was slow. It was very gradual. I had really bad side effects. Um, Not just the vivid dreams, just sick and really bad pain, headaches, terrible headaches. And by the January, because that was the sort of the 3-month mark, it was like, wow, this is clearing and it's really making a difference. My energy level had picked up. So my energy level had already picked up. But you can have a lot of energy and still some very bad headaches. And then the headaches cleared. And then I went up to 1.5. I stayed at 1.5 for about a year. And it was working pretty well. And then stupidly, see, I think this is one of the problems where you kind of guiding your own diagnosis and treatment, and you're telling your doctor what to do, basically. I think there's a real risk in that, because I thought, okay, I was kind of checking in on the support group, and some people were saying, I've been on this for a year, I've been on LDN for a year, I've become a lot more active, I'm much stronger. One lady came off LDN, she says, and I haven't needed it since then. I thought, oh, I'm feeling so much better too, let me try that. Didn't talk to my doctor about it, so I just came off. This was in about February 2023. So I had been on LDN for just over a year. Just took myself off. It was partly the cost. It's not a terribly expensive medication, but I don't have a lot of money. And I just thought, well, maybe I'm fine. Let me try. I can always just go back on. But wow, I got COVID within about a week. But first, I think it was 2 weeks I got COVID. First, I couldn't understand what was happening because I hadn't read. I don't have your book here. I think it's in my other room. I've got your LDN book, which I then got after this whole thing to learn more. I hadn't read it at that point, and I thought LDN was just treating my pain. I didn't realize it had this whole immune modulation effect. So I stopped LDN, and I didn't understand why I was very weepy. Didn't feel too bad at first physically, but weepy, crying, down, just sad about nothing really. That was obviously the depression. So now I know that it's good for depression. It's good for the immune system. It just regulates everything. And after that period of depression, which I think probably lasted about 2 weeks, I just came straight down with COVID really badly. And had to go to a day clinic. I got a drip. I got medication. I was like, hang on, this has obviously got something to do with having come off LDN. I don't know what it was. It was a mystery in my mind. I really thought LDN was just for pain. But I went back onto LDN. I still had a little bit. At that point, I was taking the drops, the sublingual drops. I went slinking back to my doctor with my tail between my legs and I said, I've got this thing to confess. I stopped taking LDN and I got really sick. Could you give me another script? I want to try taking the capsules again. It's a different compounding pharmacy. And I want to mention that because of your other interview with a South African where she struggled to get it. I haven't struggled to get it, but I'm in Joburg. There's a ready supply. You just have to go to compounding pharmacy. So she said, oh, I never knew you came off it. And that was when it really occurred to me, this is the problem. You've got the patient maybe sometimes knowing a little bit more than the GP, or kind of, guiding the process instead of the other way around and taking decisions like this. I will never do it again. I got your book after that. It arrived pretty quickly. I read it cover to cover. It was an absolute eye-opener. So by then, sorry, I was back on LDN. And I saw in one of the chapters, I don't remember which author it was, they said that when a patient does this, when they come off LDN and then go back on within a reasonably short period of time, there isn't the same adjustment. And I experienced that luckily. I didn't go through the terrible side effects again. I had a few days of really horrible headaches. Could have been COVID as well. And then I was back on that higher level, I think again 1.5, which eventually I went up to 2. And then at some point I went up to 3, which was too high for me. So I realized my dose is really on the low end, but I am super sensitive to medication. I haven't taken a lot of medication in my life. So I'm also a trauma counselor and I do this thing called TRE, which is trauma release exercise. I'm a registered provider. And at that point, I still had some people coming to see me. And for 2 of them, I actually recommended LDN. One got a bit of help from it, a bit of relief, but not much. And the other one, none at all. When I've looked very carefully, like what could it be? What is so different about them and me? And I think the big difference is that both of them had used a huge amount of psychiatric medication. I never did. Um, both of them potentially have more, primarily psychiatric issues than my Ehlers-Danlos. So I don't think either, well, the one I know didn't carry on taking, the one, I don't know if she did. The dosage of 3 milligrams was too high for me. And I struggled with that, eventually dropped it back down to 1.5. I'm now on 2 again, but what I've added, and again, at my request, asking the GP and her agreeing, was after I realized that I probably have some degree of mast cell activation disorder. So I think the thing that really struck me about your book, the LDN book, it's the third one, I think, was the glial cells. So I had done a course in physiological psychology during, it was either my third year of psychology studies or my honors year, about the brain and the hormones and the nervous system and the parasympathetic, sympathetic, all of that. So I had a basic familiarity and neurons and anything. Glial cells I hadn't heard about, but when I look back, that was a long time ago. Nobody was really talking about it like they are now. The role of glial cells in pain. But I think in a case like mine, particularly where there is clearly some kind of inflammatory and immune involvement, it's also a mast cell. I think the glial cells and the mast cell, there's some kind of connection there. So I am now on, instead of just going back up to the 3 milligram on LDN, which wasn't working for me, it was too high. I dropped back down, but I had some very violent illness episodes, odd, just weird things, just hitting out of the blue. And again, coming back and looking at all the research and the groups and everything, I thought, this sounds like mast cell activation. So I said to my doctor, is there something you can trial me on? And she's put me on the thing that people with asthma take, Montelukast. Can't remember if you said Montelukast or Montelukast. It's helped enormously. I don't have these wild attacks of kind of digestive, and I had started this kind of vomiting and everything, and this only started after taking LDN, but it could also just be that I'm older. So I think now this is the point in my life where I just feel I've got the best pain management I've ever had at this age. I mean, I'm nearly 60. I feel it's the first time I'm on top of these things. I know what my diagnosis is. I know what I'm dealing with. I've got these 2 medications in place, and I think they work very well together. And they're both, well, I think the LDN is at a bit of a low dose, but it's perfect for me. And I think what's nice is the dose can go up and down. And I have definitely experienced the need to let it go up and down at times, but for now it's stable.
Oh, what a wonderful story. That's truly amazing to think.
Well, I'm very grateful to your organization for the work that it's doing, and also to know that you're able to educate doctors like my GP. They've trained a long time ago, and this is a relatively new approach.
Relatively new, but
Relatively.
1985, yes.
I know it goes back to the 1980s, but I think it's only become more mainstream, and it's still not mainstream.
No,
And I think that's got a lot to do with the situation with the not being able to patent it and so on.
Exactly. Yes.
And that's why I thought, well, I would like to be part of getting that information out there to other patients, because if it weren't for patients who were taking it, I wouldn't have known about this. My GP knew, but they're not going to offer because of that situation. And also maybe because they don't know that much. I was maybe a bit experimental, and yeah, I just feel I got lucky. I'm sure there are medical reasons why I respond well, and the 2 people that I mentioned, my clients who've had a more psychiatric past, didn't respond well. I know that it's good for depression, but there must have been something going on with them as well.
Well, we've come to the end, but it was an amazing story. starting from when you were a small child.
Thank you, Linda.
So thank you very much for sharing the story with us today.
Pleasure. Thank you.
Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.